This evening, I'm going to share with us this presentation based on the role extension in medical imaging or radiograph, where now radiographers' roles have been extended, where we are also taking part, or radiographers can now do extended roles or certain roles which were traditionally done by other professions, one of which is the intravenous cannulation and administration of contrast media. So in today's presentation, this is the session outline. I'm going to talk about the following. First, I will introduce a few terminologies with regards to the topic or the title of just seen from the previous slide. There's an introduction. I also talk about historical perspectives regarding how radiographers' roles have been extended with respect to them conducting intravenous cannulation and administration of contrast media when imaging patients. I will also talk about the factors the influencing factors which led radiographers to start engaging themselves into performance of IV cannulation and contrast media administration when imaging patients. I will also talk about the education and the training of radiographers with regards to them conducting this duty, or which is an extended role for our profession. Furthermore, I also talk about the guidelines governing cannulation and administration of contrast media, which is done by radiographers, that is on a global perspective. I also talk about continental, from the continental perspective as well, local trends, like in our case in Zambia. Then I also further demonstrate on, we'll talk about now how the laws with regards to IV cannulation and contrast media administration is done by radiographers, with evidence from other studies which have been conducted across the globe. Then I also talk about the benefits which are associated with radiographers being given this chance or undertaking these roles, which is intravenous cannulation and the administration of contrast media. Then I'll conclude as well as the differences. So today's session basically is all about role extension, as I mentioned the area from the previous slides. So the practice of radiography is developing and changing globally, where as the case was to just taking images, which is basically plain film images, certain duties have come on board associated with certain duties have come on board now, where radiographers are capable of doing things or other duties rather than just taking images, it being ultrasound, it being CT. So now radiographers are taking on these duties, which were traditionally, in the case of intravenous cannulation and the administration of contrast media, is a traditionally role for radiologists or other health professionals, such as the nursing profession. So now, radiographers' roles have also been extended in this regard. So this presentation will now focus on discussing the principles governing role extension in radiography, which is basically radiographer-led intravenous cannulation and the administration of contrast media. So before I go any further, let me discuss or let me share a few terminologies. When we talk about, or when we talk of role extension means for any associated health worker or allied worker in the health profession, like a radiographer, involves them carrying out duties or responsibilities which are not permitted or included in their initial scope of practice. That is what role extension means. So when you talk of role extension, I'm also referring to when it comes to IV cannulation, there's a reference I'm making. Then when you talk of contrast media is nothing but a group of chemicals or chemical agents that are used to help in the classification of diseases, that is pathology, by improving the visibility of the anatomy under investigation. You are trying to improve in radiology, we say, in radiography, we call it to improve contrast resolution. So basically what you are doing when you're introducing a contrast agent, which is a chemical agent to the human body or for the anatomy under investigation, you are trying to improve on the visibility of the anatomy of interest. Then we talk of, when we talk about intravenous cannulation, this is nothing but a process of inserting a small intravenous plastic tube into a vein in a patient's hand or a arm to provide fluids or contrast media itself. So when you talk of, or when you hear a term, administration of contrast media, this is nothing but a process of injecting contrast agents into a patient through a vein. Okay. Then a radiographer, for those of us colleagues from other professions, a radiographer is a healthcare professional who operates special machines like a CT scan, an X-ray machine, an ultrasound. Though ultrasound, that is now sonography, but I would stick to MRI, contrast, computed tomography. So those people you find in the hospitals or in the radiology department who make scans using these special machines are what are known as radiographers. Like myself, I'm a diagnostic radiographer. So now this intravenous cannulation and administration of contrast media, what is it all about? So IV cannulation is explained in this manner. This is a process which involves puncturing of a vein in order to deliver iodine-based contrast agents into that vein. During a radiological examination that requires the use of contrast media. As I said earlier, the purpose is to improve the contrast resolution or the visibility of the anatomy of interest. This is done clearly to demonstrate the underlying space-occupying lesions in an event where maybe you are imaging someone for suspected cancers or tumors. So for you to clearly demonstrate that tumor, which is a space-occupying lesion, let's say in the liver, you need to use contrast so that you help to clearly demonstrate the pathology under investigation. These are pathologies which cannot be seen on a plain film image or a two-dimensional image. Then we bring on board contrast media. So the process of doing that, where you inject contrast, introduce contrast into a patient through a vein, is what you are calling intravenous cannulation and the administration of contrast media. So for those of us, contrast medias are in types, but the contrast media which is being talked about in this presentation is that type of intravenous contrast media, which is iodine-based contrast media. This bottle you are seeing on the bottle you are seeing, can you see my pointer? Anyone to confirm?
Yes, Mr. Mubanga.
Yes, so the bottles you are seeing here contains contrast, which is also in types, and they're also brand names. A good example I would give is the Ultravist. Okay, then the picture to my right, this side, is where showing a syringe with contrast being drained from a bottle. So when we talk of iodine-based contrast media, which is introduced in a vein, it can be introduced into a human body through two main ways. There is manually, where a syringe is pushed in, like you can see on this picture, or you can use, there are certain machines which come with additional apparatus like an injector pump, which is an automatic technique of contrast media administration. We use an injector pump, which you are seeing on my left, this one where the caser is. Or you can do it, you can administer it manually using a syringe, direct. A person or a nurse or a radiographer trained in this regard can inject contrast in this manner. So now, what is the historical background of this raw extension with regards to intravenous cannulation and administration of contrast media by radiographers? So how it started is that allied health professions, radiography inclusive, have started over time, have started to adopt new laws and practices, such as raw extension. It can be, or it's sometimes called advanced practice. It can be in image interpretation, but in this case, we're talking about the intravenous cannulation, which is being conducted by radiographers. In some countries, radiographers are carrying out this task, which is intravenous cannulation and administration of contrast media. This role, as I mentioned earlier, it is tradition, by tradition, is a radiologist to be is a role to be performed by a radiologist. A radiologist is a medical doctor who specializes in medical imaging, or is a specialist in that regard. So now the extension in the roles with regards to radiographers conducting intravenous cannulation and IV administration and the administration of contrast media has happened over time due to, number one, the shortage of radiologists in countries, which is also a case globally, and also an increase in the demand for medical imaging examinations. CT scanners, MRI, these now have come on board. They are increasing in number. So as the demand is growing, radiographers numbers also increasing in numbers. We are growing in numbers, but radiologists who are by mandate or by tradition are supposed to be performing this task, the numbers are still few. So hence, in some countries or in other countries, like bulletin number 2 is indicating, in the UK, about 20 years ago, started extending the roles or radiographers' duties to also include intravenous cannulation and the administration of contrast media. So then the number, as I said, to say a radiologist is a medical doctor. So the increase in the number, the shortage of medical doctors also in the UK at that time is what resulted in the nursing also. Before radiographers, the nurses came on board due to the shortages or the inadequate number of medical doctors at that time in the UK, resulted in nursing being permitted to conduct intravenous cannulation and administration of contrast media. And that is how we see up to today, the nurses having their roles extended in this regard. So now this resulted in the scope of practice for the nurses. Then, as I mentioned about 2 decades ago, to be changed to include also intravenous cannulation and the contrast media. Now, as the nurses took this responsibility, they started doing these IV cannulations and administering contrast media. The shortage of radiology nurses also further now resulted into radiographers themselves performing intravenous cannulation and the administration of contrast media when imaging patients. Okay. And this is what led to radiographers now in the UK at that time, with time now to start also having their roles extended in this regard. As we go further, I'll talk about how this happened, because you need to have some formal training and guidelines put in place for radiographers just. So when it comes to the history of raw extension with regards to radiographers performing intravenous cannulation and administration of contrast, this is how it started. Shortages in the number of medical doctors resulted in the nurses to take this responsibility. Further, the radiology nurses, even in Zambia, I don't know if we still have many or there are some. There are still few, but radiographers are readily available for this service. So hence, radiographers took this responsibility also through some formal training and accreditation. And this is how the roles have been extended in this regard. So now, imaging modalities where you find contrast media being used, or where modalities which require the use of contrast media. Number 1 is computed tomography, magnetic resonance imaging, and plain film radiography. In this regard, I'm talking about contrast-aided studies such as intravenous urography. So as you can see on this picture, there's a patient doing a CT scan with an injector pump. There's what I was talking about. So in this department, they use an injector contrasting, an injector pump to administer contrast to the patient. the patient is undertaking or is having their CT scan performed, CT examination being done here. So now, as I'm talking about row extension, what caused these radiographers' rows to be extended? I've mentioned a few reasons. So the factors now which led or which resulted in the radiographers' rows to be extended when it comes to intravenous cannulation and contrast media administration is, number one, there was inadequate use of radiographers' skills to their full potential. As the literature indicates that when a patient goes to the radiology department for a CT scan, since the radiologist or a doctor or a nurse are the ones who are permitted in many countries to conduct this task, to perform this role, you would find that a cannula has been put on time by a nurse. But the injection of contrast media would take time, or it is time consuming for you to go and look for either of the three, for any of the three, a doctor, a nurse, or a radiologist. It will take some time because by law you are not permitted, so you would wait, not until any of these three are available. That's when contrast is going to be injected in that patient. So now this resulted further in reduced departmental work on the radiography side, because a number of hours could take before contrast has been injected, despite the cannula being put on time. This now resulted in longer patient waiting times for them to have both being done, a cannula being put and contrast being administered, which now resulted further into radiographer frustration. So these few points I outlined or highlighted here are one of a number of causes which resulted in the radiographers' roles being extended. So traditionally, as I said, you would know that a medical doctor is the only one, or a radiologist or a nurse in many countries are those who are mandated. Then before it started in the UK, where radiographers' roles were extended to also include to start doing intravenous cannulations and the administration of contrast media. Now radiographers in many other countries, as I will discuss, I will share with us, have started doing or undertaking these. So this is the image here showing a hand, a cannula put there, and the tube where contrast is going to be passing through to enter the patient to enter the patient's body. So now, when it comes to radiographers performing intravenous cannulation and the addition of contrast media, on a global perspective, we've learned about how it started, the factors leading to radiographers themselves undertaking this task. So on a global perspective, in the UK, the Royal College of Radiologists provide guidelines on intravenous cannulation and the administration of contrast media. This is included because there is a proper delegation of duties and also safe administration of substances like contrast media. So radiographers in the UK, in Australia, and North America perform, or their roles have been extended to include in their scope of practice intravenous cannulation and administration of contrast media. Radiographers in these countries I've mentioned, that is the UK, Australia, and America, are suited to perform this role in these countries, owing to the fact that their respective scope of practices have been extended. This has happened because of their training programs on board, which are put in place at postgraduate level, as I will discuss very soon on the training and on education and training for radiographers when it comes to, with regards to intravenous cannulation and administration of contrast media, how it is done. They also, radiographers are going through or undergoing formal training, which I should mention here it's done at postgraduate level of education. So in these countries, radiographers' roles haven't just been extended overnight. There is some formal training with accreditation attached to that by regulatory bodies in those countries. On the continental perspective, when we talk about radiographer-led intravenous cannulations and contrast media administration, in many African countries, rural extension for radiographers is still developing, or it's still in its early stages. Take note that where radiographers' roles have been extended when it comes to them conducting intravenous cannulation and IV, intravenous cannulation and the administration of contrast media, is in the UK so far, in Australia, and in North America. And there they have some systems put in place, which is also include training at postgraduate level. I should repeat that. At continental level or in Africa, South Africa and Malaysia, these two countries have got systems in place, or they are underway for them to have their radiographers have the roles or the scope of practice extended in this regard. There are some studies which have been done, which I will show later as we go, as I discuss, as I present. On a local perspective, here in Zambia, we come to our situation here in Zambia. Radiographers are not yet allowed to perform intravenous cannulation and administration of contrast media. So now, talking about the Zambian situation, our regulatory body here in Zambia is the Health Professions Council of Zambia. So I just mentioned to say radiographers in Zambia are not allowed to conduct intravenous cannulation and the administration of contrast media. They are not allowed because the scope of practice, which is at HPCZ, does not yet permit radiographers to conduct IV cannulation. Okay, so it is important for Zambia's radiographers now to adhere to their allowed scope of practice, not until they attain appropriate training and accreditation. If there are people who are conducting these IV cannulations and additional contrast media in Zambia, take note that by law, we are not yet permitted. This should come on board with proper training and accreditation, as I will share the importance of having the guidelines which have been set or put in other countries, the training needed, which is there in other countries, for us to be allowed, or for radiographers to take part or to have their scope of practice expanded and start performing intravenous cannulation. So on the Zambian case, still on the Zambian situation, in our case, a study has been conducted, which was recently published by Dr. Wanga and Dr. Schone. This study was about a literature review which was conducted to guide training and practice of intravenous cannulation and administration of contrast media in the Zambian setup, or by Zambian radiographers. So now, the guidelines put on the education and training of radiographers, which made it possible for our colleagues globally to extend their scope of practice and allow radiographers to be performing intravenous cannulation and administration of contrast media. There are certain guidelines put. In the case of the UK, the University of Hospitals of Leicester has put these guidelines for a radiographer who is willing to undertake a training program and wants to be administering or wants to be performing intravenous cannulation and administration of contrast media. So all radiographers that inject contrast media in that country must have a College of Radiographers recognized certificate for competence or of competence in administering intravenous injections, or that radiographer must have undergone training at the University Hospital of Leicester, where there is also an intravenous cannulation course. Okay. Additionally, all radiographers that connect intravenous line to an injector pump must have acquired or must have undergone a course in self-injecting or injection of IV line using an injector pump. There is a course specifically for that in this country, in the UK, that is being done. Then all radiographers that inject contrast, okay, must also complete a postgraduate diploma course in administration of contrast media and cannulation, which is being offered at the University of West. So furthermore, all radiographers that inject contrast or connect an injector pump must be up to date to the core or to their core skills in the training they have acquired. Okay, either at the University Hospitals of Leicester or in other training institutions where these courses are being offered. So further, I said earlier, I mentioned to say the training and education of radiographers when it comes to intravenous cannulation and administration of contrast media training is being done at postgraduate level. So therefore, the combination of higher education and training with the professional necessities for a radiograph profession are of great importance in this regard. Where other countries, as I mentioned, have a system in place where training programs for radiographers specifically to perform intravenous cannulation and administration of contrast media exist for those members or those radiographers who are willing. A training for radiographers in intravenous cannulation and administration of contrast media is being offered also in Southern Europe at the University of Malta in the UK, and in the UK as well. In the UK, I just mentioned the University of Leicester, University Hospitals of Leicester. So now these training programs, they offer both the theoretical component and competency skills are assessed. Okay, so on the theoretical part, things to do with the anatomy, the physiologies, the IV, the contrast media types, reactions. These reactions, adverse reactions from mild to severe, all these components are being put and are being taught. Radiographers undergo formal training in this regard to understand the associated complications also attached with the intravenous cannulation and administration of contrast media. So postgraduate training or postgraduate radiography courses, which already exist to train radiographers in IV cannulation and administration of contrast media. Once the radiographers finish these courses in these countries, like in the case of the UK, which is bulletin number 3, a certificate, as I mentioned earlier, of competence is being issued or is awarded or is conferred to this person who has undergone training. Then they can be fully accredited and registered to be a specialist or to just be a radiographer trained or specialized in intravenous cannulation and administration of contrast media, just like the other radiographers specialize in image interpretation. This practice is being done in the UK and is being facilitated where accreditation is concerned by the College of Radiographers, where a certificate is being administered or is given upon completion of training. So a sample study here was done also in South Africa to assess the training requirements for the administration of contrast media by radiographers from a radiologist's perspective. This study was done in KwaZulu-Natal province. Okay. So now the guidelines on IV cannulation and administration of contrast media in these countries I've mentioned, to start within the UK, these guidelines have been put in place to guide the performance of this task by radiographers who have undergone formal training in these institutions I've mentioned. So in the case of the UK, the Royal College of Radiologists offers or have got documents like you can see on my left side where the pointer is, where guidelines are fully stipulated, which should guide this practice. On the other hand, in North America, the American College of Radiologists also has put up guidelines for radiographers to be following or to guide them in the practice of intravenous cannulation and administration of contrast media upon undergoing some formal training. So now, what is the importance of having these guidelines in place? We've talked about the training associated with the education and training of radiographers before they start embarking on these extended roles. In this case, intravenous cannulation and administration of contrast media. What is the importance of having? So the number one is take on point is that these national guidelines, like in the case of the UK and in the Americas, help radiographers to have adequate information on the safety and complications which are associated with intravenous cannulation and administration of the contrast media when imaging patients. Furthermore, these stipulate how these complications, if there are any you are encountering in the process during the imaging procedure, during imaging of that patient, can be avoided or arrested on time. Additionally, who should be responsible in the event that the patient reacts to the contrast agent? Yes, people go through formal training, but again, they should be, these guidelines will help to clearly state who should be responsible in the event that that happens. Okay, so the who should be responsible in this case, like I mentioned earlier, to say for this task to be performed, or this duty to be fully performed, in the event that, keeping in mind that we said that intravenous cannulation and administration of contrast media by tradition is a duty for a radiologist. A radiologist who is a doctor by training, then specialized in imaging, are the ones who manage the complications associated when a radiographer is working and the radiographers are conducting these tasks, these additional responsibilities. So a radiologist is the one with a mandate to take care of any complications associated to that, to contrast media reactions when imaging a patient. So now these guidelines will clearly indicate and stipulate who should be responsible for the safety and any other complications associated. So that's why there is that system of delegation between a radiographer and a radiologist, or between these two professions. So now, currently in the Zambian case, there are no guidelines for the administration of contrast media by radiographers. This is owing to the fact that contrast media administration is not yet within radiographer's scope of practice. However, in 2021, a committee was set by HPCZ through the Radiological Society of Zambia to review the current scope of practice and make some addendums or add some advanced roles, such as intravenous cannulation and administration of contrast media by radiographers. Though not yet permitted, so this system or this review was conducted through the Radiological Society of Zambia, which was done in addition to the regulatory board, which is the Health Professions Council of Zambia. So systems are coming up on board. So radiographers' roles are still not yet, in the Zambian case, where radiographers are not yet permitted to perform contrast media administration. Am I audible enough? Mr. Kawapai, can you confirm?
Very clear, sir.
Yes,
All
you
right.
are.
The internet was, this is the message which came. Okay, so radiographers' roles now, going forward, through some formal training As you can see, these points highlighting a review was set, and the current scope of practice was reviewed, and there were some addendums made. In this case, some roles at advanced level or specialization have been put, which also includes intravenous, cannulation, and the administration of contrast media. So now, these guidelines, which should be put in place in the Zambian case, like I have just mentioned, in countries where radiographers are taking part or the roles have been extended in this regard, I've put up proper national guidelines, formal training, and accreditation. So in the case of Zambia, the guidelines are to be drawn by the Health Professional Council of Zambia, which is the regulatory body for health professionals, in consultation with relevant stakeholders such as clinical health facilities, the higher education institutions like the Lusaka Apex Medical University, University of Zambia, and different one. At this stage, I should mention that a radiographer in the context of this, in relation to the topic of interest today, which is raw extension in radiography, a radiographer in this context means both radiograph technologists and radiographers. Okay. So now these guidelines are to be drawn or are to be drafted or are to be done by the regulatory body in consultation with the stakeholders, which includes also training institutions, radiologists themselves. As I mentioned earlier, to say a radiologist is one who is responsible to manage the adverse reactions associated with the contrast media. So establishing national guidelines in our case, like in Zambia, would now enable all aspects to be to do with the monitoring and controlling of radiographers in the practice of duties such as or extended roles such as the intravenous cannulation and the administration of contrast. These set national guidelines for Zambia will then help to extend the existing scope of practice upon having radiographers who are willing in Zambia to undertake this formal training, the guidelines put in place, then it will be easier and way fair to extend the existing scope of practice for Zambian radiographers. So now I've been talking about radiographers' roles being extended, like we've learned or we have shared in the case of the UK, in the case of North America, in systems like in South Africa at continental level where they are developing implementation plans. So what are the benefits associated with the intravenous cannulation and administration of contrast media being done by radiographers? As we said, this role is, I repeat, is a traditional role for radiologists, which nurses also just extended their scope of practice due to those reasons which were earlier shared. So now what are the benefits? The use or extending radiographers' roles to include intravenous cannulation and contrast media administration when imaging patients. The number one benefit is that the radiographer performed IV injection, which is intravenous cannulation, allow effective and efficient use of the existing human resource, thereby giving the radiologists enough time to conduct additional procedures such as interventional procedures and also image reporting, like reporting images on time. That would give them ample time and enough time to take up these other roles. Given the national shortage of radiologists, in the case of Zambia, we only have 12. So if radiographers' roles in this regard have been extended, that will give sufficient time for radiographers and for radiologists to perform other tasks. Okay. This also further will increase or result in job satisfaction. Okay. Additionally, they will be an increase in productivity and performance among radiographers, or in these countries where radiographers' roles have been extended, our colleagues are experiencing these benefits, a sense of job satisfaction. As you can see, if you are good at something, you are doing it to your level best professionally, there is people get to notice and there will be some fame attached. Fame is an intrinsic factor which contributes to motivation. So then that is how job satisfaction, or you can look at job satisfaction into those regards. Motivation comes in. Additionally, on the patients, in terms of service delivery, the patient's waiting time would be reduced. As I mentioned earlier, to say number one cause is time is a lot of time is being consumed or looking for a radiologist or a nurse to perform both IV cannulation, then administer the contrast. It will take sometimes, if the radiologist is busy, in the event that they are reporting, maybe on a CT image, they have a number of images. The radiologist in that case has to first finish the reporting, then come and attend to the patient who's maybe been waiting for over 2 to 3 hours. So when a radiographer takes up this responsibility, that patient who spent some 2-3 hours, the patient waiting time there and hospital stay can be reduced if radiographers are being given this mandate. Of course, through some formal training and accreditation for those who are willing. So you find that the benefit also is both the radiographer as well as the patients. They will be reduced. There is always reduced patient waiting time, which would also be a good number one. It could be number one point take-home message when it comes to quality assurance. If patients are being seen on time in hospitals, that also improve on the delivery of patients as a service, as well as the end result is improved patient delivery and overall patient management. Then patients would be managed on time. So some sample studies which have been done with regards to radiographer-led intravenous cannulation and admission of contrast media. This study seen here was done in Malaysia, where perceptions of radiographers were investigated on how willing they are to undertake this task. If their roles could be extended with regards to intravenous cannulation and admission of contrast media. This study was done in both private and public hospitals. And the study showed that radiographers in this area or in this country were more than willing to take part in this task, having their roles extended. Okay. Another study which was done in the UK was on the use of intravenous contrast media in radiotherapy for planning during CT scans. This study also shows, though it being in radiotherapy, but it shows how contrast media is being used and how really radiographers are also eager to take part in responsibilities like this. Upon acquiring some formal training and accreditation, which would also bring about in other countries, incentives are created for that. That also leads to the benefit we talked about, like job satisfaction. Then another study was done to include now the infection control component. As I said earlier, to say there are some safety and complications associated with intravenous injections. So in the event that they are to arrest or to reduce or to control the infection associated during those vein punctures, this study was also conducted in Highland, where now radiographers, which was talking about the policies which have been put in place to look into infection control with regards to radiographer-led intravenous cannulation and the administration of contrast media. Okay. So, in conclusion, before these radiographers' roles have been extended in this regard, as shared earlier, we can see that first there should be formal training provided for radiographers willing to take part in intravenous cannulation and administration of contrast media. Okay, at postgraduate level, where both theory and the skills of competence are assessed. Furthermore, national guidelines should be put in place to help, like in the Zambian case, as I mentioned, to say HPCZ, which is the regulatory body for both the registration of radiographers and accreditation, should set up or should come on board to set up guidelines to guide radiographers willing to take part in this responsibility or who wants to have their roles extended in this regard, undergo formal training. So prior to doing also to extending radiographers' roles, as I said, say HPC should engage stakeholders like local schools of radiography should be invited on board and be considered to set up accredited programs or an accredited program, which should be issuing radiographers with qualifications. It can be a postgraduate level, or like our colleagues are doing it in the UK, there is a certificates are being issued. So it depends. When formal training is there, local guidelines in place, then it will be easier, or it makes the work easier for the existing scope of practice to be extended when it comes to intravenous cannulation and the administration of contrast media. For those radiographers, of course, who are willing to take part in this regard. At this point, I can invite any questions.